Just a few years ago, there was a woman who studied nursing just down the street, and then more recently she came up with a fabulous idea, and it doesn't really involve any technology at all, but it involves a lot of common sense and good patient interaction, family interaction, and really good communication. It is my privilege to introduce to you Sharon Schindler Rising.
In 1993, I was a nurse midwife caring for many, many, many prenatal women. One woman's question was another woman's question. And what I was doing was spending my time repeating myself almost all day. And besides that, I was saying, so sorry, because I was keeping everyone waiting. I couldn't run on time. I thought, there just has to be a better way to do this. So I want you to imagine for a moment that you're a pregnant woman and that you've come for care, you've been invited to join with a group of other women, maybe about 10 or so, and you come to this room directly. You don't stop in the waiting room, you don't have any wasted time. There's music playing, it looks really inviting, and you come in and someone shows you how to take your own blood pressure and how to do your weight, and you chart on your chart, and you have this little brief encounter, this private encounter with your provider, but it's still in that group space. And you look around and there's some food, and you start saying hello to other women who are due during the same time period that you are. And you think, I'm starting to understand that what I do directly affects my pregnancy, and I'm understanding more. It's all getting demystified.
So I heard a question on the floor. What do we need to pack in the bag?
Pajamas for you, because you don't want to wear the ones that they give you in the hospital. Your whole butt be showing. Make sure. One thing I like about the class is that we all have open opinions, and we all get to help each other out with the difficulties of being pregnant, and we get good mothering help from the midwife, Beth.
Patients actively participating in their care is the piece that's missing in healthcare right now. It's like, why is that? How could a patient possibly feel empowered and feel like someone really cares to have them involved in their care when we structure traditional visits to be 5 and 10 minutes long?
This is a moment of crisis in our healthcare system in the United States, and people are really looking to make some differences. However, it is a struggle between those forces that have built the medical care system and those who are trying to improve health and improve the health of populations.
Well, I think there are 3 components to care that really should always be there. And one component clearly is assessment, or the checkup, the healthcare visit itself. Another is education.
Or come in.
Most of us want to know more.
Is it okay here not to know?
Yes.
Yeah. Okay. So why do we think the people are agreeing? Why do we think?
And then there's this other component of support, or community building, which I think is harder to get. People often say, well, why is this called centering? Well, everything is centered. It's brought together into one whole, and it all happens within the group space.
I think that centering really offers the ability for patients to learn about their condition, about life, from a different lens and not so top-down, to really make connections in their community and to really learn in depth more about, what's going on with them.
In a large randomized controlled trial published in 2007 of over 1,000 subjects, the primary outcome, which was impressive, was the reduction in prematurity rates of 33% in the overall group and 41% in the underserved group, which was largely African American.
We see consistently increased breastfeeding rates, better attendance at visits, And with prenatal care, one of the really important indicators is increased return for that postpartum visit. We've often talked about the appropriateness of centering for care from birth or even preconception to hospice and end of life. It has wide application across the whole life cycle.
I had a patient who was really struggling with issues around medications for diabetes. In particular, he really needed to be on insulin, and he was trying to do everything he could to be healthy, but he really did not want to start insulin for his care. In one of our group sessions, we asked him to talk a little bit about that, and he presented his concerns to the group. By the end of that one group session, he was ready to start insulin. And since that time, I believe his life has been transformed. One, by the love that he got from the group and the support, but two, by now feeling comfortable taking a medicine that has made him now feel well again. And he's feeling really, really positive about who he is and what he's achieved.
America needs a healthcare system that's going to produce healthy Americans who are capable of living healthy lives. And in order to do that, we have to move away from this approach that is all about disease towards one that promotes healthy lifestyles. To me, one of the major components of that needs to be a model such as centering, in which people are participating in the healthcare system together and learn how to support each other in making the right kind of health decisions.
How do you get started with this? That's a real question. And CHI is available to help with every single step of the process, from the original information to ongoing consultation and training and help with getting systems ready to finally to site approval.
I can't emphasize enough that this is a doable change. However, you have to involve everyone. You have to involve everyone from the CEO to the frontline staff.
We found that this is one of the most exciting parts of our residency for our residents. They have been some of the prime movers of getting our centering pregnancy groups up and running. They come back excited about it. They find that it's a whole new way of relating to patients, and it's also a much more effective way of promoting health and dealing with problems than the old individual visit model of prenatal care.
Centering is something that I really have enjoyed. It's been an important part of my residency training. I've really been able to connect with the women in the groups.
I see women bonding and enjoying their care in a way that I don't see in one-on-one encounters.
I'd be interested to see how this could work in a resource-poor setting, particularly in places in Africa where I'm interested in working, specifically because it has a huge potential to make care more patient-centered and patient-friendly, to create an environment where we can disseminate information across communities.
We have watched the model be implemented in a variety of populations. So Indian Health Service, the military, international work, First Nations, Canadian work, Australia, the United Kingdom, and a lot of interest in Africa. So why do we think the model would work with all these populations? It's because we are meant to be in conversation with each other.
I believe that this is the beginning of a movement towards health and away from disease-oriented healthcare in America, a movement towards having people who are participating in their own healthcare and understanding with one another and developing social connections that are enabling them to live healthier lifestyles. And I think that this is because of the fact that it's so popular with our patients and that our doctors are embracing it, this is just the beginning of something that will eventually take over the entire healthcare system.
I had a provider call me one day and she said, "This is the one thing in my week that brings me joy."
A little healthier, a little slimmer. She just said I just lost a whole body. That's a good one.
Centering is a great way to feel really empowered during your pregnancy and to gain all of the knowledge to make it the best experience possible.
I come here and I'm laughing, and laughter is always good for both baby and mother.
Everybody coming together on a monthly basis at the same time, and really putting the effort forth to make it happen makes it work.
Nice group of women, and like I said, you get a lot more information.
We're going on the same path, and definitely I felt the benefit of cross communication. It made me feel better.
I like the people. I like the teachers that help us. I think it's the best experience I ever had in my life. I really do.
It is very fun. Very, very fun.